Another health concern this morning, something that has a lot of people across the nation worried.
Doctors are now trying to find out if the Enterovirus that attacks the respiratory system of children played a role in at least one death. ABC's Lindsay Davis has the latest.
This morning, new concern that respiratory illness striking children across the nation may be deadlier than first thought. Officials now revealing samples collected from 4 patients who died tested positive for Enterovirus D68, though the role the virus played in the deaths is unclear. Among the victims, Emily Ortrando from Cumberland, Rhode Island, a Girl Scout and artist who loved nature. Just 10 years old.
She got a little short of breath. Her parents didn't think much about it, took her to the hospital. And really, by the time she got to the hospital, everything fell apart.
The 5th grader's condition deteriorating in less than 24 hours. She not only had EVD68, she also had a staph infection, a very rare combination. Now a scramble to get the word out to kids at Emily's elementary school. Parents who were initially told Emily's death was not related to EVD68 received an email Wednesday from the school district assuring them of additional precautions of having each school classroom and all school buildings cleaned.
Make sure your kids are washing their hands 5 or 6 times a day. Make sure that anybody with asthma has their asthma under good control.
The CDC has confirmed cases of the virus in 42 states and the District of Columbia. Doctors in Colorado feverishly trying to determine if Enterovirus D68 is to blame for the at least 10 cases of paralysis-like symptoms in young patients with respiratory illnesses there. In Boston, 4 patients exhibiting polio-like symptoms are also being tested for Enterovirus 68. And overnight, brand new cases of partial paralysis reported in Michigan, too.
We have been looking into how Minnesota may be affected by Enterovirus 68, and we reached out to the state's Department of Health this week. Here's what we learned. Minnesota is not counting cases of the virus because the Department of Health says it's not a reliable indicator of activity here.